Okay, everybody ready to learn? Everybody fired up? All right, I want to thank Dr. Moore. Where are you? I want to thank you for kind of getting everybody fired up. We all stand on the shoulders of those who come before, don't we? So I'm going to stand on your shoulders, and maybe Robert can stand on mine. We've got a lot to share with you, and we've got a short time, so I'm going to get going. First of all, I want to thank the Hogg Foundation for having me here, and I want to thank Bastrop, Brooks, Morris, I knew I was going to forget one, Nacogdoches and Victoria counties for sharing the evening with me last night. Could all of you stand? Because I think you need some recognition here. Could all of you stand up? Stand on up. All right. So these are the grantees of this rural initiative. I know there are a lot more of you here, and I'm very happy to have you here, but I just wanted to kind of set them out because they're doing this work, and they're really charged, really fired up. I went home, I could hardly sleep. Literally, I looked at, of course, I wear my watch. I said, 4 hours and 20 minutes. I better get some more coffee. All right, so let's get started here, and I need my thing. So I want to start by saying just one thing, and if you take nothing home from today, the idea that collaboration is everything in this work. How many people believe that? Collaboration is absolutely everything. It's at the heart of what we do. And there is a definition for collaboration, so I'm going to share it with you. Formal, sustained commitment, so remember, marathon, not a sprint, by several organizations and individuals, I will add, to enhance each other's capacity to a common mission. So developing that mission and vision together. And the way you do it is you share the responsibilities, the risks, and the rewards. Everybody's there to share the rewards, right? Everybody is there to share the rewards. But are they there to share the responsibility that it takes to get the job done and the risks that it takes to put yourself out there when people are going to be critical, when people are going to say, why are you focusing on that? Why did you invite these people? So you've got to be willing to accept that risk. All right, so collaboration at the heart of it. We call, just like Shakespeare said, a rose by any other name would smell as sweet. Remember that line? We have lots and lots of names for collaborations, a lot of them. And I just listed one of probably about 25. I know we're calling the groups here in Texas, these rural initiatives that we have, collaboratives. I tend to use the word coalition and partnerships as long as we're kind of on the same page of what we're talking about here. And that is, it's a group of individuals. The key thing here is they represent diverse organizations. So I was asking folks last night at the dinner, I said, so who are you representing? And they said, we're representing Bastrop County. And I said, but who are you representing in Bastrop County? Well, we're representing the Bastrop County Initiative. What's the name of the Bastrop County? I'm sorry. Bastrop County Cares. Everybody has their own name. I don't want to forget it, but I didn't remember it. Bastrop County Cares. But I said, but who are you representing? So there's got to be a constituency behind you if you're going to have power. So it's not just Mary and Celia and Joe sitting at the table. It's Mary from this neighborhood. It's Joe from this church. It's Bob from this business. That's what's going to bring power, that exponential power. That's what we're looking for. Anyway, so it's those individuals who agree to work together toward a common goal. That's it. That's what all these groups are. And if you get down to the heart of it, they'll all have a different definition. But that's really what we're talking about. And I use coalition more, but trust me, I also mean collaborative. So what happens here? What we're trying to do is we're trying to unite the grass tips of the community. All right, that's the traditional leaders, those who have been in power before, those who are the recognized leaders that kind of drift up and you see in the newspaper, you hear on the news. And we're trying to get the grassroots of the community. So they're the indigenous leaders. They're the people who have been there, have been fighting this fight, who have been working for equity, working for better health, working for better housing, working for fair job and wages. Right? We're trying to get those groups together because in each of those groups, whether they are recognized or not, there are leaders who people believe in. And you can go to any community, and I've done this in communities where I've never lived, and you just start talking to people and asking them on any health issue, if we took mental health. If you had a child who you thought was depressed, who would you go to for advice? By the way, they rarely say my doctor, right? But some names start appearing over and over. You start hearing them. Miss Miller down the street is very helpful. She's a retired nurse, and she's really been able to help me out a lot. And then you start hearing Miss Miller's name, Miss Miller's name. Now, she's not the head of anything in that community. She's not the head of the neighborhood association. She's not the head of the PTA. But she's someone who has that wisdom and knowledge and trust that people go to. That's what we're looking for here. That's the part of it. We already got the grass tips. We're looking to build up the grassroots of the community. Anybody not believe that? That's what we're trying to do in this work. What makes collaboratives effective? Well, you can go to any author, any book, any expert on building communities, and they will have their own list. So, of course, I have my list. These are the things I think that are the most important that I've seen over 30 years in all kinds of communities, urban, rural, working out in Alaska where there's hardly any organized community that I saw. And it's this. Number one, common vision and mission. If every single person in your collaborative doesn't know what your vision and mission is by heart and believe it and keep coming back to it, you haven't done your job in building that collaborative. So I put it on every piece. When I was running coalitions myself or managing them, put it on every piece of paper. It's on at the start of every meeting. What is it? Why are we here again? Because there's a whole lot of noise. And there's all kinds of people and organizations in your community, just as you're really trying hard to do this work, that are going to say, why are you doing that? We want you to focus on. We're not concerned about housing here. We want you to work on, don't you care about the children? So you've got to be very clear. There's a whole lot of things we can focus on. You've got to be very clear on what is that key thing, and you have a laser focus on it. You keep coming back to it, and it drives your work. Secondly, transformational leadership, and we'll talk a little about that later. Committed, engaged members, not chair warmers, engaged, committed members who show up and do the work. Fourth, high levels of trust and reciprocity, meaning I'm going to share what I have from my organization. I'm going to get something from this collaborative, and together we're going to achieve more. 5, frequent communication and training. Communication is at the heart of collaboration, isn't it? Isn't that where most things kind of fall apart? I heard him say that she wasn't, right? All this rumor starts going on. Number 6, just enough structure and process. So I believe in structure, actually, but I don't believe in overbuilding what you don't need. So everything I'm going to tell you, you just take this into your heart and decide what of it you want to use and what of it you want to throw, just like the wheat and the chaff, right? The grain and chaff. So use the stuff that's helpful to you. And what works in one place won't work in another. I don't really know Texas. I lived here twice. Also Army. Where's Robert? Yeah, so my husband was career military too. So we were at Fort Sam in San Antonio. And I've come to Texas a lot because I love Texas. If I'm invited to Texas, I'm coming. You know why, really? Because you're warm and welcoming, that's why. So I know it's going to be good. I know it's going to be a good visit. But I don't pretend to be a Texan. I don't pretend to know what it's like to live in your community. So you just take what works that I'm going to share with you today. So what is it that we expect these collaboratives to do? That's a big list. How many of you felt overwhelmed, especially the grantees or any of you who have received funding, when you realize all of a sudden after the glow wears off, and you realize, oh my gosh, we have to do all that? Gosh, we got to analyze the issue, we got to assess the community, we got to develop a plan, we got to get people working, and we have to show something at the end. And what we're looking for this change, right? We're looking for big change. So how's this going to happen? Wherever you are in this circle, and you can look at this and probably figure out exactly where you are now. I talked to some people last night who were right there at that formation. They've just been together since, the fall, and they're just starting to gel. And there are people who have been doing this for 15 years. So wherever you are in this cycle, just start wherever you are. Okay? There's no magic formula here. But as you go through these stages, and this is really public health talk here, but I had to put it up here because at the heart I'm a public health person. So formation, implementation, maintenance, and institutionalization. Now I've changed it, and especially in this last iteration when I did write Ignite, I said I'm going to think in different terms. I got to get out of some of this public health speak. So I changed those to before you build it, make it work, and sustain it. All right, and we'll talk about that a little bit. But what I want to say is that collaboratives go through these phases more than once. So a coalition that I started back in 1993, still very active, a child health coalition in my part, Eastern Virginia, part of the state. It's had probably 4 lives over that time. So we formed, we reformed, we did work, we went back and changed it. We had new funding, new members. Every time you change your focus, change your membership, add to it, you're going to have to go through some of these stages again. Because you don't want everybody to feel left out, right? You don't want anyone to feel left out that's at your table. So why do we do it? What are the benefits? What reward are we going to reap, besides the fact that we're going to do good? Well, we know that by collaborating together, we've got strengths. It's all about building strength to strength. So there's strength in relationships, there's strength in diversity, and especially when we include people who have not been included before. And I think that's what I'm really excited about by this particular initiative and by this workshop today. We're really looking to say there are people, intentionally or unintentionally, either overlooked just because we didn't know, or overlooked because we decided we didn't want to share the power that we had. So we've got to make sure we're focusing on building this diverse organization. Strengthen resources, and you can go to any community. I don't care where it is, any community in the United States of America, and there are strengths there. It can be the most under-resourced community ever, and you will find strengths. And of course, strength in numbers. And that's what you've got to really consider. That you have the power in this group that you build, that when you go to your councilman, like Robert Schenkel, and say, this is a problem in our community, and the mayor's council needs to lead an effort to change things. And he says, well, very nice, Mrs. Smith. I'm so glad you have that problem. And we'll look into it. Now, when your collaborative goes to Representative Schenkel and say, we now have representatives from every single part of this community, and we need change to happen now. Do you think he might want to listen to you a little more? Okay, so strength in numbers, very important. What are the challenges? There are lots of them, but these are the ones I hear about a lot. Organizations decide, I don't know if I really want to be part of that group. There's going to be some things I have to do that I don't know if my organization will like. I don't know if it will fit with our mission. I don't know if it will fit with our priorities. We might lose competition. This is what I hear from hospital and health systems all the time. We've got our covered lives here. I don't know if we want to let that data out to the hospital system or health system down the road. That might make us a little more vulnerable. I think most people will agree. It's kind of a little easier to agree with the mission and vision. But how we do things, how we're going to do it. So even if you agree on the goals, which is a big thing to develop, how are you going to do it? And everybody's going to have their own idea of how to do it. So how do you meld that into a workable plan? Thirdly, we are stretched thin, especially in the communities in rural America, right? And in rural Texas. So now you're saying, we know you're stretched thin, but we want you to give a little more. So this is a big ask. It's a big ask. And lastly, it's going to take a while. What do you think is easier if you were trying to come up with your plan of what you're going to do in your community? To sit down with 3 of your best friends in a closed room for 4 hours? Could you come up with a plan? You could. I've done it, actually. All right? How long is it going to take to come up with a plan with 55 organizations in your community, or 20, or 10? What did you say? Say it loud. 18 months. Yes, that's being realistic. But how likely is that plan going to be accepted if you've really taken the time to think it through and hear all the voices that are competing, right? So you go into this work knowing that's the one thing. These other things we can do something about. This is one thing that you just have to accept. It's going to take longer, but it's going to be better. It's going to be stronger. It's going to be more likely to succeed. So I'll finally get to this framework of Ignite, and I know you can't see all this. You have the books, which is great because this is now the shortcut. But what I was trying to do in this particular book is to kind of get away from the 660-page book that Coalitions and Partnerships is. And I know people like it, especially academics love it. People whose job it is to manage and run collaboratives or foundations love it. But it wasn't very useful for every person. It wasn't useful for volunteers. It wasn't useful for those of you who are in how many are in leadership positions in their collaborative? Could you raise your hand? Whoa, we got a lot. Okay, it wasn't even helpful for you because, by the way, this is just one thing that you do, right? This isn't your full-time job. So people kept saying, does anyone here remember Cliff Notes? I mean, it's how most of us got through high school English, right? Cliff Notes. So this is the Cliff Notes version. This is 150 pages. You can sit down and read it in one sitting. And I tried to think, what are the real key things we need to learn here? And compared it in a little bit of a whimsical way, just because I decided it would be more fun for me. Compared building a coalition and sustaining it to building and sustaining a campfire. Now, I'm in Texas. I don't think, is there anybody in this room, and there could be, I don't know where you live, is there anybody who has not sat before a real fire for enjoyment? Anybody in here who has not sat before a campfire, a fireplace, a fire pit? Anybody? With real wood now. Real wood, not gas flames. So what I decided when I was taking care of some very remote property we own up near Shenandoah National Park in Virginia, as I was building, and I'm always the one who has to take care of the firewood. My husband chops it down. He says, you take care of that big giant pile of stuff that's a mess. And it takes hours, if you're really going to do it right. And you've got to be careful how you do it. So as one day I'm sitting there for 3 hours, feeding in the things, don't want to get sparks, I'm thinking about it, and I said, this is kind of what building a coalition is like. There are things you got to do to make sure that fire is going to be successful. That you've taken all the fire danger and the wind and all those conditions and dry leaves blowing around, and should you do it or shouldn't you? There are things you have to do to kind of build that base and get all your firewood gathered and your kindling and your tinder. And then there are things you need to do to just kind of get that nice fire moving, and some of it you want to keep warm, some of it you just want to burn the trash, some of it you want to cook, some of it you want to sit around and sing around a campfire. So you want to make it work for you. And then lastly, you want to make sure that it's around long enough to keep you warm or to cook your food or whatever it is you plan to do. So that's how I set the framework for this. I'm going to take you through that now. What do you do before you build it? I'm going to spend 1 minute here because I know is there anybody here who's just contemplating building a partnership or coalition? Anybody? So some of you are. Okay. So you got to read that part of the book because I'm not going to focus on that. But what I will say is 2 things. You need to think about this a little bit first before you get started. What is it you're trying to do? And what environment are you building this collaborative in? So taking a lot of things into account. Who are the populations you're trying to reach out there in your community? In public health for a long time, and still today I hear it, and it kind of breaks my heart. We talk about target populations. Have you heard that term? Yeah, I want you to wipe that out of your vocabulary. And if you just change that word target and make it priority, what does that do? Doesn't it change everything? If you say to a neighborhood or a school or a church or a business, you are one of our priorities. Whoa. Now all of a sudden, instead of nobody wants to be the target of anything. So who are the priority populations you're trying to reach? Does geography play a role? Does it in Texas? You have a huge state. It's a long way from one place to another, right? I've got a state where there's water everywhere. Where I live, it's just bridges and tunnels, and it's very hard to get around. You have to allow an extra hour anywhere you want to go if you're crossing a river because invariably there's someone broken down in the tunnel, right? And there's an hour wait. If you live in a mountainous community, I just came back from a trip in Utah, you look on the map and I say, this is going to be a piece of cake. We're going to go from Bryce Canyon out there to Arches, and there it is right there on the map. What I forgot is there's this huge, giant canyon land in between. You got to drive 300 miles around it, right? So geography plays a role, and you got to take that into account. What's the history of the community? What's the history about everything? Economics, politics, race, religion. It all plays a role. Your coalition is embedded in your community. It's part and parcel of it, so you need to know that history. Is there a culture for collaboration? Do people want to collaborate? Now, you're gonna ask them to collaborate whether they want to or not, right? But it's good to know that ahead of time, that there's going to be some resistance. So you want to find that out. And lastly, what are the challenges you might face? And what are the assets that community brings to bear? Because every community has assets, every single community. What do we need to do to build it? And again, I'm going to tell you a lot of this, I know you know, but for those of you who don't, I just want to share it. You got to know your community. You got to study it. There's so many tools out there that are available to you. The county roadmaps, your county health rankings. You've got data and data. All of you have community colleges, have health departments, have social service departments. That's part of their job. Hospital systems, to collect data. And you want to get your hands on as much data as you can to inform you. So when someone says, I don't know why you're concentrating your work in this little corner of the county that only has, 1,000 people, only has, 5,000 residents. We got big problems in Austin. That's a big city. We should be spending our time there. So you've got to know why you're doing it. You've got to know what the data is. And then you've got to get out there to see if what you learned, all this head stuff, academic stuff, if it matches what you see. One of the most important things I used to do with coalitions that I worked with is just all of us get in a couple of vans, get in a bus, and go out and visit the communities that we're trying to work in. Start talking to people. So it's not just some statistics out there. These are real lives that are affected, and we need to learn what those are. So get out there and talk to people. We have to recognize and respect diversity. I mentioned this before. In all its forms, in every possible way, so that your collaborative matches the community you're trying to reach. And I don't mean tokenism here, right? I'm not talking about making sure you have one Asian person and one rich person and one old person and one. That's not what I'm talking about, right? But you match the diversity of your community. And then figuring out who are the organizations and individuals you want to recruit to the table. So start mapping out who do you want to invite. Now, I would say everyone is welcome, all are welcome, but you're going to very specifically focus on some of the groups that you need to have at the table. I use a wheel. I start thinking, and this is just one, and I borrowed this from a group in Kansas that was working on the opioid epidemic, which is really high there. But who are the sectors of the community that you're trying to reach? So schools, law enforcement, it depends what your issue is, who you're going to reach out to. But figuring out those 6 to 12 sectors in your community that you're trying to reach, and then figuring out within those sectors, who are the organizations, who are the individuals, and what are the organizations that you want to invite. And then you start asking those people that you invite, who else should be here? Once you have your plan, you're going to recruit again. Because now you know you're going to focus on 1, 2, 3 things, and what other organizations need to come with you. Besides that sort of sector organization, you need to think through what are the special skills you might need. So when last evening, I was speaking to one group, and I'm thinking it was maybe Morris County. But I spoke to someone who was a realtor representing the business community. I talked to someone who was a banker finance person. There was someone who was a newspaper reporter. What county was that? Help me out. It was Morris, okay. And I said, wow, they've already, just the people that are here, got some really important representation. So sometimes you invite an individual who has very specific skills that you need, and that's important too. Oop, sorry. Okay, so when I look at this slide, I see these happy babies, right? Everybody loves a baby. And I think, why are these people that we have invited and these organizations we've invited, why are they going to join, number one, and why are they going to stay? So I think these are the reasons. And just like these happy babies, they want to believe in something, their mom or their family. They want to have relationships with each other. They want to accomplish something. They want to be recognized, have some influence, know that what they're doing is going to make a difference. And some people just want to be there because they want to be in the know. So when folks say, how big should a collaborative be? You know, everybody wants it. And now that we're doing stuff, people just, and they all want to join, and they weren't here at the beginning, right? I'd say the more people that are in there, the more the word is going to be spread, the more the work is going to be shared out. And you will have some people, I think of them like friends of the collaborative, who just want to be there, so their name is on the attendance sheet, you know, so their boss knows they came. But, you know, that's okay, because sooner or later, something might be sparked in them that makes them want to do something. So you don't want to leave anybody out. Nobody. And why do people go? So to me, sometimes they just look like this real unhappy, sad baby. They just don't feel included. They don't feel respected. They don't agree with what's going on. They don't think their voice is being heard. They're not even sure what they're supposed to do. They never were involved in any collaborative. They don't really know what this means. They're coming maybe because they're curious at first. And maybe they're unhappy because they don't see anything happening. So we want to remove all of those things. All those things we can deal with. But we've got to recognize that people may feel a little bit left out. So what we've got to do is make sure that people know what their job is, why they're there. They're not there just to be in attendance. And to me, every single person that shows up in your collaborative is there to be a leader at some time. At some time. I know when I join an organization, I just know down the road, I'm going to have to take a leadership role. I expect it's going to happen. And it's my job to do that. And you start small. If people don't have experience, one task, then another, then another. And I'll share one very quick story. We had a woman who was 76 years old when she joined our Child Health Coalition. And she started with she became the historian. She would collect newspaper articles. We were focusing on immunization for children. She'd collect everything in the news that we needed to know. And then she got involved with that, and then pretty soon she said, well, I'm kind of interested in working on this group that's working on public awareness, so I'll go there. And then she became active on that group and became the vice chair, and then she became the chair. In the end, we were having an election and we had formal elections for the chair of the coalition. And someone encouraged her and said she should run. She said, well, I'm too old now. She said, I'm 77 years old. I can't run to be chair of the coalition. But someone convinced her. So we had 6 people running. I think it's because they knew they could attend this big annual meeting we were having in Arizona, and they thought that was really, really fun. So everybody did. I said, well, okay, here's what we're going to do. Everybody's going to give a little 1 or 2 minute talk about what they're going to do if they get elected, how they're going to run. So everybody got up, and Betty was last. And she got up and she said, she said, I don't have a PhD after my name. I'm not a social worker. I'm not a nurse. I'm not a school teacher. She said, what I am is a grandmother. I have 7 grandkids. And what I want to know, what I want to make sure that happens to me is every day, at the end of the day, I want to look in that mirror, and I know if I have helped a child today in some way, I'm going to look at myself in the mirror and say, Betty, you did a good job. You have a good night's rest. And if I didn't, I'm going to toss and turn all night long. So I'm here to make sure that our kids get what they need. Well, by the end, people are just like, almost teary-eyed. And one by one, everybody started saying, I think I'm going to withdraw I think I'm going to withdraw. And Betty was elected unanimously. We built up some of this leadership. She had some natural talents, but she knew what her role was, and she developed it. Every member should be recruiting other members. Every member should know that there's a sharing that has to happen between their organization or community and that collaborative, and they're going to take something from that collaborative. So it's reciprocal. They need to have support. They need to have support from their organization, and their organization needs to support what the collaborative is trying to do, and they need to be an advocate. At some point, they need to be willing, they and their organizations need to be willing to stand up and say, I care about this issue, and we need this change to happen. whether it's a law, whether it's an ordinance, whether it's a new building that gets proposed, whether it's new school lunches in the school, a walking path in the park, a full-service grocery store, whatever it is. So if people don't know what their role is, they're not going to keep showing up for you. And if they don't volunteer, they can be voluntold. Sometimes you just have to say, Roberta, I think you would be terrific to help us with this. Now, wouldn't you want to do this? Wouldn't you want to do this? And that's how you get people sometimes to step out of themselves and take a risk. So, vision, mission, and goals. Every organization needs to have it. Mission, this is the vision, rather. This is where you want to be in the best of all possible worlds. If you could wave a magic wand, this is what you want for your community. That's the vision. That's actually not very hard to arrive at. People want to be healthy. People want to be safe. That's pretty easy to come up with your vision. The mission says, what are we going to do to achieve that vision? So the mission is a doing statement. It's a doing statement. One statement, one sentence, one breath. If it goes on for 2 paragraphs, and I've seen them, if you have to take a breath, your mission statement is too long. Okay? Very clear. And you come back to that mission over and over and over. And when someone says, I don't know why we're doing that, why don't we focus on this? And how will that lead us to our mission? How will that help us achieve our mission? And then lastly, your goals. Those are the very specific things that said, this is how we're going to make this mission a reality. We're going to develop the ability for people to walk anywhere in this community so they're healthier. As I said before, just enough structure. That looks like a lot, right? So I kind of focus this toward the grantees. You've got you're the grantees. You've got your collaborative there in the middle. You've got the Hogg Foundation behind you, at least for this 3-year journey. And then you have some leadership. I tend to call it a steering committee, not a executive committee. Steering committee, a leadership team. And then you've got some groups that are doing work. So call them that. Call them a work group. Call them an action team. Something that says, what does the word committee say to you? Boring. Boring. Sitting there again and again, same agenda. No, you want to do something. And then maybe you have some task groups that are just going to go out there and work for a little bit. This is where you can get very busy people. Say, could you just come together for 3 meetings because we need to develop our website. We need to develop our policy plan. All right? So think of that as just kind of an overarching structure, and yours could look very different. There are other things you need to make sure you've got. Some guidelines for how you're going to work together. They can be very simple. They don't have to be bylaws, but sometimes you will, especially if you're together a while, you're going to need something that says this is how we vote. These are the things we vote on. This is how we elect our leadership. Make it very short because, bylaws everybody has to vote on. So you don't want to keep changing them every year, right? So make them simple. How are you going to meet? How often are you going to meet? When are you going to meet? Are you always going to meet in person? How many collaboratives out here meet by phone sometime? Virtual meetings. Yeah, that's not a lot. How many of you would like sometimes to not have to get in your car and leave your job and come to a meeting and spend 15 minutes and park your car and get out and then? So now the hour meeting becomes a 2-hour meeting, right? So think about this. If you know each other well, you can get a lot done over the phone. And you've got freeconferencecall.com. Doesn't even have to cost you anything to have a virtual meeting. You have an agenda, you have minutes, and you get done actually faster, believe it or not. Documents, so your minutes, your agenda, all these, your records of the work you do, very important. And then how are you going to communicate together? So is it always by email? Is that the best way? Does everybody have access to that? How are you going to communicate? How often? And you've got to develop your leadership. So these ladies represent probably the most unlikely group that came together. They were worried about diabetes in their community. And Beverly on the very end of that community. This is Jenkins County, Georgia, just outside of Savannah. Probably of everywhere I've ever been to work, the most under-resourced community I ever worked in. And I didn't understand it till we did an analysis. We did it. Anyone knows what a SWOT analysis is, right? What are the strengths and challenges of this organization? What are the opportunities and threats that are out there? And when we sat down to do that together, because we needed to learn about what was going on in this community, they could not come up with one strength. I've never, ever had it happen. Not one. And with some coaxing, we finally came up with one. We said, our faith community in Jenkins County is very strong. That's the one. I said, well, that's a start. That's good. We got one. And these ladies came together. Beverly was a city council or county council person. And she said, I just found out that our county has the highest rate of diabetes in the United States of America. And obviously, the highest rate in the state of Georgia. And we have to do something about that. So she gathered together. Everybody know what a first lady is of a church, especially an African-American church, the pastor's wives. And she voluntold them that they would become leaders of this coalition. Excuse me, the Jenkins County Diabetes Coalition. And in 2 years, it was just incredible with it. They were invited to the American Diabetes Association to do a presentation on all the work they did to bring in, first of all, a real grocery store to Jenkins County, because all they had was 7-Elevens and dollar stores. They had one 7-Eleven and $2 general stores. That's what they had for food. So incredible. And what they had, they were transformational leadership. You can read about it. But these leaders were inspirational, influential. They considered everybody as being important and vital to the group. And they stimulated people to think about things differently, that they could make change, that this wasn't a negative place to live. So you can read about them, but they are really incredible. And to me, they were the epitome of what I mean when I talk about someone who's a transformational leader, these 5 women. What do we do to make it work? Well, we got to engage people in the work. You hear a lot about community engagement. What does that mean? It means people are informed, they're committed, they know what their job is, and they do it. They're engaged. And every part of it. So if you're doing community assessments and you haven't involved all your members in some part of that, they're not going to feel part of the results, right? Everybody is involved in all phases of the work. They come up with a plan. This is where the rubber meets the road. This is action plan. Has anyone done one yet? Come up with their plan yet? For any of your collaboratives. 1-year plan. This is our mission. These are our 2 or 3 goals. These are the 5 things that we're going to do to make these goals a reality, right? So an action plan. Secondly, we've got to really figure out how do we not just educate people, because a lot of it is making people aware of how important health is, but how do we make sure that we're changing policies, systems, and environments? Real change that's going to make a difference in the community. That's really what our goal is. Am I right? Right? How do we sustain the work once we've started it? Well, first of all, you got to keep people interested. This work should be fun. It's hard work, but you can make it fun at the same time. Your meetings, your activities, and your collaboratives should be the best thing, work-related, that people do all month. And you can make that happen. I've seen it. I've gone to where I'm ready to join the coalition myself by the time I leave. I mean, it's just a vital, stimulating group. And you've got to make sure you've got the funding in place. So right now, you've got that first one, especially the grantees here from the Hogg Foundation. But that isn't going to sustain you. From day one, you've got to start thinking, where else are we going to draw from our communities to make sure we're around here? So that coalition I talked about, the CINCH, the Coalition for Infant and Child Health, we've had money and we've had no money. But what you are trying to do, and I'm going to say this twice, what you are trying to do does not take much money. What you're trying to do does not take much money. It takes will. It takes political will. It takes some money to get started, and it will take money if you want to have a staff person there to guide you and be the glue for your organization. But you can find ways to fund that person. I have never, ever been in any community when people wanted to do something and it was a good idea and it was based on science and it was based on experience that people couldn't find the money to get it done. I see a lot of skeptical faces out there. I'm telling you, this is true. If you come up with something and you base it on science and you look at the assets in that community and you mobilize them and you've got people caring, you are going to be able to get your work done. And it's not going to take a lot of money to do it. Because the big change money-wise you're going to need is if you're trying to build something bricks and mortar, walking paths and recreation centers and, bringing, but a lot of it is really changing the policies and structures in your community. All right, so all these things are ways that you can raise money for your group. I will say the Hogg Foundation is the best marketer I've ever seen. I told people this the past couple of days. I've had so many people call me that I haven't heard from in years. They say, here you're going to Austin, Texas. I said, how'd you know that? Oh, I saw it on the media. I said, wow, really? I mean, it's marketing, getting the word out. So someone in your group, in your collaborative, needs to have this expertise. So the rest of the community you're working in knows what's going on. Getting the word out. Get some young people. Believe me, they're the best communicators I know. This is a way to involve the youth in your communities. They know all the social media platforms. Their little network can spread incredibly. So getting the word out, important. And then evaluation. And I know you have an evaluation person. Where's John? Where are you? There he is. He's going to be helping you with some of your evaluation work. I know you have the Prevention Institute on board. You've got a great community here in the Austin area. So, how do your efforts lead to change? You've got to, what are you going to put into it? What activities are you going to do? What are the tangible things that the community sees out there that you're doing? And then how do they lead to those short-term, intermediate, and long-term outcomes that you're looking for? We call this a logic model, and I'm sure you'll be putting together one of those if you haven't already. But it's just a way to visualize what it is you're doing. All right, so evaluation is key here. If you don't evaluate, the chances of you being refunded are slim. The chances of people caring about what you do, because you haven't been able to show that you've had results. So you've got to evaluate. And then you've got to be adaptive. Remember those Valspar commercials? I guess it's the husband and wife chameleons out there. So you've got to be as adaptive as that, because this environment changes every single day. We've got a very volatile government right now. So a lot of people are reeling. They're not sure what's going to happen tomorrow. Your coalition has to be very quick to act. Okay? So before you build it, make it work, sustain it. How many people feel confident right now that they can step out there and do this work? Stand up if you feel confident. Stand up. Thank you. Thank you. Thank you.